Welcome back to Your Health Matters. My guest today is Dr. Christopher Johansson, and we're talking about breast cancer imaging and all of the Mayo collaboration that we have here at KRMC. It's great to have you on the program, Chris.
Oh, thank you.
So we were talking about the tomosynthesis, that's easy for you to say, not so much for me, machine that we have here at KRMC, but you were sharing there's some other new technologies as well.
Absolutely. So in addition to the tomosynthesis machine, which KRMC acquired, we also purchased a new stereotactic biopsy table. So when you do breast biopsies, there's a few ways that it can be performed. The most common are with ultrasound or with mammogram guidance.
Okay.
A stereotactic table allows us to use mammograms to do biopsies and interventions in the breast.
Okay.
The table that we have is brand new, and it also came with some comfort features that some of the older tables didn't include.
Oh, that's good.
So it makes the whole procedure a little more comfortable than it has been in the past.
Excellent. And again, we talked about that early diagnosis can make such a difference for recovery.
You know, it's been incredibly well proven that breast cancer prognosis is most dependent on the size of the cancer when it's detected. For very small cancers, the success of treatment is incredibly high, over 95% for
Wow.
low-grade tumors. And sometimes we can detect precancerous lesions, and the rate of cure is even higher.
Wow.
Unfortunately, when cancer is not detected early, that rate drops precipitously.
Sure.
If we're not detecting cancer early enough, the prognosis can become very dismal.
Well, and I keep reiterating this, but it's so true that early diagnosis, and that, of course, is another program that KRMC has started, is our Catch It Early program, where we're offering, in the month of October now, women can get a mammogram for up to no more than $50 if they are uninsured or underinsured. Because a lot of times I think that's the main reason that women might put off having a mammogram done. They might say, well, yeah, I know I'm supposed to have it, but I don't have insurance, or my deductible is so high, I just can't afford it, and it's kind of putting it off till later maybe.
Well, it's a very easy thing to put off, because what we're looking for with mammography are things that can't be felt, that you can't palpate, and that you don't know are there. It's easy to think that you don't need screening mammography, because the point of screening mammography is to look at people who don't have problems, who don't have symptoms, who aren't feeling anything, and detect these tumors while they're very, very small.
And again, because then you catch them early, and then it makes that difference for recovery. So part of when we talked earlier in the show about the new navigator position, and I think that's another piece of what that person will be doing is education, right, going out to the community in outlying areas as well, like in Meadview, Dolan Springs, even Peach Springs, to let the women out in those communities know about the programs that we have available. We also partner with the Well Woman Health Check program that throughout the year can offer both free mammos and pap smear checks for women as well, again for uninsured or underinsured. So we'll make sure that they get the word out there about
That's
that.
one of the really nice things about working with a place like KRMC that's nonprofit. They do a lot of things to help women who may feel that because they have low quality insurance or because they're uninsured that they won't have access to these kinds of screening procedures. I would encourage them to call KRMC and see what programs are available to help them, so that we can make sure they get the kind of treatment that they need in spite of any other financial factors that may be in play.
Absolutely, because you know, one of those things, when you put things off, you actually increase your medical costs in the long run.
Absolutely.
Because it's going to take more expense to treat it.
Well, and the main thing is, you know, it will have a bigger impact on your life. It'll be a more difficult position to be in, not just financially, but from a health point of view, and that's what concerns us. We don't want any women, regardless of their financial status, to not get the kind of treatment or screening that's going to help them to stay healthy in the long run.
That's great, and that is it. It's about now with the cutbacks in healthcare and with access and Medicare, it's more important than ever that we stay healthy.
Absolutely.
You know? Because if we don't have insurance, then you have to make sure that you do what you can to keep yourself healthy. And that's kind of what this program is about, is bringing information out there to the public about programs that we have. In October, we're going to be doing some other things as well. We have our Breast Cancer Survivor Luncheon, that we have a time of celebration for those women, and as we've talked about now more than ever, the recovery and survival rate for breast cancer, of course, is increased astronomically from what it used to be. And so this is a time for them to celebrate their recovery.
It's really one of the best parts about being involved in breast health is to see all the women that have gone through treatment and are now back to doing their regular lives, are able to do all the things that they did prior to their diagnosis and treatment because they had their cancers caught early, were treated, and their life is really in the long run unaffected.
Okay, that's great. Now, when you're at Massachusetts, what other things, I mean, your fellowship was in Massachusetts, right?
Yes.
And specializing in the
Yes.
breast cancer imaging.
Yes, so I took a year, and rather than going out into practice, I went to Massachusetts General Hospital and worked with their full-time breast imagers doing nothing but breast imaging, breast diagnosis of cancers with biopsies and other interventions, and just learning how to meet with patients and explain the different aspects of cancer detection and treatment.
Great, because education, again, is really important.
Absolutely.
I think that makes a huge difference when people know and understand what they're fighting and what tools they have available for them. So from Massachusetts, then you came here after that
Yes.
little 2-day honeymoon.
Yes, so in the interim, I got married, convinced my wife that a 2-day honeymoon was fine for now, which she must love me very much because she agreed
Absolutely.
to, and then straight out to Kingman to start working.
Great. Well, hopefully you'll get some little breaks and you can take little short honeymoons around our great state. There's lots of things to see and do nearby with the Grand Canyon and, of course, the Wallapies. I don't know, have you been up to the Wallapai Mountains yet?
Yes, we have. We've started to explore Kingman and
Good.
the area just a little bit on the weekends, and we're both absolutely so happy to be here.
It's
I
different
think
than Minnesota,
it
no
is.
doubt
I
about
think
it.
that happiness will only grow as December and January come around. I'm hoping we can have
Absolutely.
some of our relatives come down and visit us and maybe move to the Kingman area as well.
Great. Well, I know that's what happened. My husband and I moved here, and we had no family here, and now we tell people we've been responsible for part of Kingman's growth because we have so many family members here now. But the Wallapies, share with people too, that's my idea of a perfect winter is when you can drive up the road 15 minutes and play in the snow, build a snowman, have a snowball fight, and then drive back down and get out of it.
Well,
Unlike Minnesota.
Right. When we were looking for a place to come, of course, our first priority was a hospital that would help us to practice high-quality medicine, but it didn't hurt that Kingman is a beautiful area to be in, that it has mountains and wonderful weather.
Right.
That definitely helped us in our
Right.
decision to all settle here.
And like I said, if you get homesick for snow, that's what I tell people all the time. If you really miss it, you can just drive up there to January, February, play in the snow, and then, okay, good, I get to leave it now. And it's not going to be here till March or April. It's a good thing. And of course, the Wallapies also, they've got great places to hike, and the elk and deer are all over up there. I don't know if you've eaten at the lodge yet, but that's pretty fun too.
There's just so much to do around here. It's amazing. It's a wonderful place.
I always laugh when people go, there's nothing to do in Kingman. I'm like, really? You need to just get outside your front door.
They've never been to South Dakota.
That's right. Watch the corn grow, right?
Oh, I better not make fun of my home state, but,
I can do
there's
it 'cause I was-
yeah, you're also from there.
Yeah, right. Yeah, we used to tease my cousins back in South Dakota about that too, that they were watching the corn grow. So what other kind of things do you and your wife like to do for fun?
Well, we definitely are spending time together as newlyweds.
Sure.
That's probably the most fun thing to do. We both enjoy reading. I enjoy Tai Chi.
Oh,
It's
very
one of my
good.
hobbies, and I look forward to really starting that up again out
Good.
here and just working out and staying healthy and
Super.
enjoying all the new things that we have to see and explore here in Kingman.
Good. Well, we're really excited, as I said, Dr. Johansson, to have you here. The talent you're bringing and the new technologies that you're bringing, I think, will just help overall to improve the health of Kingman and the women here. And it's just an honor to have you here. And I hope that both you and your wife just get settled in really quick and enjoy it a lot as much as we do.
Oh, thank you so much. I appreciate
Okay, it's been
it.
good to have you on the show. And if anybody has any questions about events that are coming up, like I said, October is a busy month, from our Women's Health Fair to the Tough Enough to Wear Pink Rodeo, the Survivor Luncheon, any of those things, you can call 757-0664 if you'd like to learn more about those. And we hope you'll join us and wear pink all month long to just help build awareness for breast cancer here in Kingman. Thanks for joining us. Have a great week.